come on back. You all right?
Yeah, I'm fine.
I'm going to have you stand right here. That way we can do an eye test for you. To start off with, I'm going to need you to cover your left eye. And then you're going to start with this first row here and keep saying the letters until you can't see them anymore, okay?
H, X, V, D, E, N, Q, R, S, T, L, T.
All right. That's good. That's good. All right, now I'm going to need you to cover your right eye. And do the same thing.
H, B, V, D, S, K, L, P, R, T.
Okay. We're good. How did you get here to this appointment this afternoon?
I drove.
Probably gonna have to confiscate your keys. I don't think it'd be a good idea for you to drive back.
Why?
Your vision's gotten slightly worse since you've been here last. And when I mean slightly, I mean we'll talk about it in the room. You wanna follow me in this room right here? Go ahead and have a seat. All right,
Helen.
so what are we in here today for?
Well, there's just been general tingliness and numbness in my hands.
Like pins and needles
Yeah.
feeling?
Yeah, and I've just been really tired, and I've been weak and uncoordinated, and I can't
Yeah,
work
since you
out.
fell in the office earlier. Does that happen a lot?
Yeah. And I usually work out a lot, but I haven't been able to lately. It's kind of
Depressing.
Yeah.
So you would say depression is definitely a symptom that you're experiencing.
Yeah.
Anything else that you've been going through?
I guess I
Well.
can't see that well.
Yeah, we kind of established that earlier. Yeah, you're probably gonna have to call somebody to come pick you up because I don't think it'd be a safe option letting you drive yourself home. Okay, so before I go get the doctor, I have one more test to perform on you. Have you ever had your reflexes tested before?
Not in a while.
Okay, so typically we're just gonna see how fast you react, just to make sure so I can report that to the doctor. So I'm gonna need you to look away off to the wall, and then when you feel me tap, you'll reflex, okay? Okay, so Dr. Glass will be right in.
Thanks.
Hi, I'm Dr. Glass. I know that you've had a lot of different symptoms lately, and I think your most likely diagnosis is multiple sclerosis or MS.
Okay.
Since I'm an internal medicine doctor, I am going to send you to a neurologist who is a specialist that deals with this, but I can also be involved in your care. One of the things that's very important when you have multiple sclerosis is to make sure that you're healthy in every other respect. Make sure that all your immunizations are up to date. Make sure that you don't have diabetes or something else that can worsen the MS. I can also be here if something comes up suddenly and work along with your neurologist to help care for you.
Thank you.
Hi Helen, I'm your neurologist, Dr. Glass. I'll be taking care of your MS and making sure that I can control it as much as possible. So first thing I wanted to do is explain to you what exactly happens in the body when you have this. And it's an autoimmune disease, which means that your own immune response, so like your T cells and things like that, are attacking your myelin, which is covering your nerves. So as you can see in this picture, there is the normal myelin and what it should look like. And then when the immune response occurs and the T cells attack the myelin, it breaks down, like you can see. And when that happens, it makes the nerve fibers, it makes it harder for the nerve fibers to pass messages along, which is the job of the neuron. And so it can either make your responses go haywire or make it take longer to generate a response. These are your three basic neuron types. One is what you use to sense things, so like if you feel pain or heat. The other just brings it to the main parts of your nervous system, which are the spinal cord and the brain. And then the motor neuron, which is what you and your disease is dealing with, is the one that helps you move. And so as you can see, this is the chain reaction that goes on when you feel something and need to generate a response. So this is the part that is affected by MS.
Go.
So you have intermittent symptoms, right? They come and go?
Yeah.
Okay, that means you have relapsing remitting MS, which is good for you. It's a lot better than the progressive MS where you just get constantly worse. As you can see in this picture, this is a healthy brain. This is one with relapsing, what you had, and this is one with progressive. And this is after quite a while of having the disease. But saying that, you can have a pretty normal life expectancy. Okay, so we've explained how your condition works. Some of the main symptoms that come along with it are having random muscle movements. You might have trouble controlling your muscles. And along with that comes having trouble controlling your bladder, having trouble speaking. But those really only occur during the times when you have attacks. And the medicine that I'm going to put you on will reduce the frequency of those attacks. Some less common symptoms are, well, not less common, but less problematic are the vision problems, feeling dizzy. You can be sensitive to heat sometimes, maybe have some trouble thinking. And most of those we can treat with drugs that are just symptom-based. And here's a little summary of what goes on in MS and the treatment options and things like that. The treatment that I chose for you, if you accept it, is a drug called Copaxone. Basically, because this is an immune-mediated disease, this drug will help regulate the reactions of the T cells to the myelin, and it will hopefully help them not become as destructive to the myelin around your nerve cells. That is something that you would take all the time, every day probably. It's a shot that you have to do. Most people learn to do it by themselves so they can do it at home. It doesn't have any major side effects except maybe a little bit of swelling and itchiness where you do the shot. Itchiness? That's a word. Itchiness. But other than that, the symptom or the side effects are really mild and there's not much you should be worried about. As for your life with MS, you'll have to get some regular exercise, change your diet, because you need to make sure that you're as healthy as possible so that the disease doesn't have much to work with. Because if you develop another disease and it piles on top, then that's not good for this disease, let alone anything else. As far as life expectancy goes, you can expect to live pretty much a normal life. The life expectancy might be a little bit shorter, but not much at all. As far as the attacks, that's really when your MS gets bad and noticeable. And when those do happen, just call me and I'll prescribe you some steroids, which can help make the immune response better and hopefully decrease the symptoms.